Welcome to the Medical Excellence Center. Today's lesson is about types of shock, and we will review the mnemonic, RN CHAMPS. Understanding shock types, RN CHAMPS, Mnemonic Overview. Introduction to shock. Shock is a critical condition that occurs when the organs and tissues of the body do not receive an adequate flow of blood. This diminishes the oxygen supply to cells, leading to cell damage and potential organ failure. Various types of shock exist, each with distinct treatments. Respiratory shock. Respiratory shock happens when there is an impairment in respiratory function which leads to inadequate oxygen being delivered to the blood. It can be caused by severe asthma attacks, lung diseases, or obstructions in the airway. Key characteristics. 1. Difficulty breathing. 2. Blue skin or lips, cyanosis. 3. Rapid breathing. Treatment. Efforts are directed towards restoring normal breathing and may include oxygen therapy and medications to open airways. Neurogenic shock. Neurogenic shock occurs due to damage to the nervous system, which can inhibit normal regulation of blood pressure and circulation. Common causes include spinal cord injury and significant nervous system trauma. Key characteristics. 1. Low blood pressure. 2. Slow heart rate. 3. Symptoms of neurological impairment, such as weakness or paralysis. Treatment. Management typically focuses on stabilizing spinal injuries and maintaining adequate blood pressure and heart function. C. Cardiogenic shock. This type of shock happens when the heart fails to pump effectively. It is often caused by severe heart attack or heart disease. Key characteristics. 1. Chest pain. 2. Irregular heartbeat. 3. Shortness of breath. Treatment. Treatment options include medications to improve heart function, surgical interventions, and in severe cases, mechanical support like ventricular assist devices. H. Hemorrhagic shock. Hemorrhagic shock is caused by excessive blood loss. Common causes are severe injuries, internal bleeding, or complications from surgery. Key characteristics. 1. Rapid heart rate. 2. Pale, cold, clammy skin. 3. Weakness or fainting. Treatment. The primary focus is to control bleeding and restore blood volume, often with fluids and blood transfusions. A. Anaphylactic shock. Anaphylactic shock is a severe, life-threatening allergic reaction which can lead to extremely low blood pressure and airway constriction. Key characteristics. 1. Difficulty breathing. 2. Swelling of lips, tongue, or throat. 3. Rash or hives. Treatment. Urgent administration of epinephrine, adrenaline, followed by antihistamines and steroids to manage symptoms. M. Metabolic shock. Metabolic shock occurs when severe changes in the body's metabolism lead to inadequate oxygen utilization or energy production. It can result from severe infections, organ failure, or hormone imbalances. Key characteristics. 1. High or very low blood sugar. 2. Severe acidosis or alkalosis. 3. Lethargy or unconsciousness. Treatment. Treatment is condition-specific but generally involves correcting the underlying metabolic disturbance. P. Psychogenic shock. Psychogenic shock involves a sudden, temporary reduction in blood flow to the brain, typically triggered by intense emotional stress or traumatic events, known as a vasovagal syncope. Key characteristics. 1. Fainting or near fainting. 2. Dizziness or lightheadedness. 3. Nausea. Treatment. The main approach is calming the patient and addressing any immediate physical injuries from fainting. Supportive care and monitoring are usually sufficient. S. Septic shock. Septic shock happens when an infection leads to dangerously low blood pressure and organ dysfunction. Key characteristics. 1. High or low temperature. 2. Confusion or delirium. 3. High heart rate. Treatment. Critical treatments include antibiotics, intravenous fluids, and medications to support blood pressure. Conclusion. Each type of shock requires distinct recognition and management strategies. Understanding the differences is crucial in providing timely and effective treatments to improve patient outcomes. Always seek immediate professional help in cases of shock. Thank you for learning. Join and save a life with us at the Medical Excellence Center.